If you're over 65, there are certain medical tests doctors recommend all the time. But what if some of them are actually doing more harm than good? What if the very checkups meant to protect you are leading to unnecessary stress, treatments, and even dangerous side effects? Today, I'm going to walk you through 5 medical checkups I personally would avoid after 65, and more importantly, why. Now, before we begin, this is not about ignoring your health. It's about being smarter, more informed, and avoiding procedures that may no longer benefit you at this stage of life. Because after 65, your body changes, your priorities change, and your healthcare strategy should change too. So let's start with something that surprises most people. The first checkup I would think twice about is routine full-body scans. These scans are often marketed as a complete health overview. Sounds great, right? One scan to detect everything. But here's the truth. These scans often find things that aren't actually dangerous. We call these incidental findings. Small abnormalities that would never cause problems in your lifetime. But once they're found, they trigger a chain reaction. More tests, more scans, sometimes even invasive procedures like biopsies. And all of this creates stress, anxiety, and risk without real benefit. Imagine this. A tiny spot is found on your lung. It may never grow or affect you. But now you're going through months of testing, worrying every night, maybe even undergoing surgery you didn't need. After 65, the goal isn't to chase every possible abnormality. It's to focus on quality of life and meaningful health improvements. Instead of routine full-body scans, focus on targeted testing based on symptoms and your doctor's guidance. Now here's the second checkup I'd reconsider. Frequent cancer screenings without clear need. Cancer screenings like prostate tests, colonoscopies, or certain imaging tests can be life-saving when used correctly. But after a certain age, the benefit starts to decrease, especially if you've had normal results for years. For example, many men continue getting PSA tests for prostate cancer well into their late 70s or 80s. But slow-growing prostate cancers often don't pose a real threat at that age. Yet once detected, they can lead to treatments that cause serious side effects, like incontinence or sexual dysfunction. Similarly, colonoscopies may not always be necessary after 75, especially if your previous screenings were clear. The key question becomes, will this test actually improve my lifespan or quality of life? If the answer is no, it might be time to reconsider. Always have a conversation with your doctor about whether a screening is still appropriate for you, not just routine. Now let's talk about the third checkup, annual stress tests for the heart without symptoms. This is a big one. Many people believe that regular stress tests are essential to check the heart. But if you're not experiencing symptoms like chest pain, shortness of breath, or fatigue, these tests may not provide useful information. In fact, they can sometimes lead to false positives, results that suggest a problem when there isn't one. And that can lead to unnecessary procedures like angiograms or even stents. After 65, your focus should be on managing real risk factors: blood pressure, cholesterol, blood sugar, and lifestyle habits. Walking daily, eating well, managing stress, these do far more for your heart than routine stress tests without cause. So unless your doctor sees a specific reason, this is one test you might not need every year. Now the fourth checkup I would be cautious about: bone density tests done too frequently. Bone density tests are important, especially for detecting osteoporosis, but doing them too often doesn't give you much new information. Bone changes happen slowly. Repeating the test every year may not show meaningful differences, but it can create unnecessary worry or push you toward medications you may not actually need yet. Some osteoporosis medications come with side effects that need to be carefully weighed against the benefits. Instead of focusing only on tests, focus on strengthening your bones naturally through weight-bearing exercise, proper nutrition, vitamin D, and calcium. Testing has its place, but over-testing can lead to over-treatment. Now here's the fifth checkup that often surprises people: routine blood tests done too frequently. Yes, blood tests are useful, but more is not always better. Many older adults get full panels done every few months, just to check. But small fluctuations in lab values are normal, especially as you age. These slight changes can lead to unnecessary concern, more testing, and even medications that may not be needed. For example, slightly elevated cholesterol or blood sugar might not require aggressive treatment in someone over 65, especially if they're otherwise healthy. Treatment decisions should be based on overall health, not just numbers on a report. So instead of chasing perfect lab results, focus on how you feel, your energy levels, your mobility, and your daily function, because those matter far more. Now I want to pause for a moment and say this. This doesn't mean you should stop going to the doctor. It means your healthcare should become more personalized. After 65, medicine is no longer about just in case. It's about what truly helps. And that brings us to something very important. Common mistakes people make when it comes to checkups. One of the biggest mistakes is assuming that more testing equals better care. It doesn't. In fact, more testing can sometimes lead to more harm than benefit. Another mistake is not asking questions. If your doctor recommends a test, it's okay to ask, what will this test show? Will it change my treatment? What are the risks? A good doctor will welcome these questions. Another mistake is comparing yourself to younger people. What works at 40 may not apply at 70. Your body is different, your goals are different, and your care should reflect that. Now let's talk about what you should focus on instead. Because avoiding unnecessary tests doesn't mean doing nothing. It means doing the right things. First, prioritize movement. Daily walking, light strength training, and staying active are some of the most powerful treatments you have. Second, focus on nutrition. Whole foods, balanced meals, enough protein, and proper hydration can make a huge difference in how you feel. Third, maintain social connections. Loneliness has been shown to impact health as much as smoking. Stay connected with family, friends, and your community. Fourth, manage stress. Simple practices like deep breathing, meditation, or even quiet time can improve both mental and physical health. Fifth, get enough sleep. Sleep is when your body repairs and restores. Poor sleep can affect everything, from memory to heart health. And finally, keep regular but meaningful doctor visits. Not just for tests, but for conversations, guidance, and support. Now, if you've made it this far, I want you to do something important. Comment below and tell me, have you ever had a test that caused more stress than benefit? Your experience might help someone else make a better decision. And if you're finding this helpful, make sure to subscribe, because I break down complex health topics into simple, practical advice you can actually use. Now let's quickly recap. After 65, these are the 5 checkups I would think twice about. Routine full-body scans that find more problems than solutions. Frequent cancer screenings without clear need. Annual heart stress tests without symptoms. Overly frequent bone density testing. And routine blood tests done too often. The goal is not to avoid healthcare, it's to avoid unnecessary healthcare. Because the truth is, the best health strategy after 65 isn't about doing more. It's about doing what matters most. Listening to your body, focusing on quality of life, and making informed, confident decisions. You've spent a lifetime taking care of responsibilities. Now it's time to take care of your health in a smarter way. So the next time someone recommends a test, don't just say yes automatically. Pause, ask, understand, and choose what's truly right for you. Because your health deserves intention, not just routine.